sa plus 2, plus 8, meron po 650 million doses na kakayahan. Ito po facility na ito. Para naman po sa negative 20 degrees centigrade, they have 40 million doses capacity. And for the negative 70 to negative 80 degrees centigrade, they have 6.5 million doses na kakayanin po ng kanilang facilities. Kaya, hindi lang po yung facilities dito, meron din po sila sa Davao City and Cebu City. So, they are also strategically situated to be able to very responsibly deliver the vaccines all the way from their Manila or Metro Manila hubs to their regions, in regions 11 and region 7, and also the delivery supply chain can reach to the actual vaccination sites. No? So maganda po, end-to-end supply chain system is adequate as far as our assessment or evaluation today is concerned. And we are confident that there's going to be a lot more capacities that we need to ensure for a successful rollout of our immunization program against COVID-19. So again, I would like to thank the Zwellig Pharma for the very warm reception. They were very gracious in giving us an actual tour of the facilities, but this was preceded by a briefing, a video showing of how the system from the end-to-end supply chain system that is being managed by Zwellig Pharma is concerned. No? So again, we thank them as well as the media for staying with us, and we have more inspection visits to make, just to make sure that there is confidence in so far as the adequacy of cold storage facilities is concerned. So maraming salamat po.
Thank you so much. Thank you so much, Secretary Duque. And now let's start with our question and answer portion. For our media friends, please state your name, the media company that you are representing, and who are you, kung kanino po yung inyong tanong. Let's start with who's the first one to ask?
Secretary, sir, good afternoon. I am Vivian Gulia from ABS-CBN. I would like to know the cost for these facilities, cold storage facilities. How much will it cost the government to store the COVID-19 vaccines in this kind of facilities? Secretary Duque, Secretary Galvez, or Sir Mike?
We will still discuss this with the pharmaceutical company, which really, and also with the vaccine manufacturer, because we're still on the middle of the negotiation of the supply agreement. Mm-hmm. But more or less, we can see for each vaccine, more or less there is a rough estimate of maybe $2 or $2.5 per dose. That's our internet calculation. Mm-hmm. Because we also look at some pharmaceuticals. That's there, more or less ranging from $1.5 to $2.5 per dose. Mm-hmm. That's the requirement for. But we still have to negotiate with the vaccine manufacturer and also with the pharmaceutical cold storage facility.
Sir, Michael?
Yes, I think we're at the first stage where we just first go through the assessment, make sure that we meet the requirements, and after that I think we will go into further discussions as to what services and SLAs will be agreed upon, service levels, and then we take it from there. But I'm quite confident that we would have very competitive and attractive rates that would meet the requirements of the government.
Yes. Secretary Duque, based on the inspection that we had today, you mentioned that there is adequate capacity for COVID-19 vaccines. How many, that's just based on the 3 storage facilities that we visited, how many more cold storage facilities are you going to visit or are you considering? And when are we expecting the government to actually pick which storage facility it will use for the COVID-19 vaccines? Because I understand that we are expecting the first batch of deliveries next month.
Let's put it in its proper perspective. The goal of the national government for this year is to be able to import 150 million doses of different kinds of vaccines. No? So we have 7 as of now that we are considering. But we must remember that the 150 million doses will not all come together at once or in one sitting. So we will have to really be very clear about the schedules of deliveries. Then, in accordance with the set schedules of deliveries, we will be able to align the cold storage facilities. And so we cannot be also saying we will use all the cold storage facilities. I think it is more because it will entail cost. No? So it is prudent that there has to be a very good plan. Okay? So which means yung delivery schedules, alam natin, ilan yung darating by every week or every month. I think Secretary Galvez might have the more complete info on this. But as I have said, planning dictates that there is an alignment to the schedules of deliveries, and so we will ensure that the capacities are there when those first or second and down the road batches of vaccines will arrive. So kasama po, pinaplano na po natin lahat ito.
Secretary Galvez, can I just get an update on the schedule of arrivals of the vaccine? Previously, you mentioned February 20, Sinovac vaccines are expected to arrive, and then another vaccine is expected to arrive next month. Meron po bang changes? May mas ilang, especially when it comes to the volume and the arrival of the vaccines?
Nakita natin yung arrival po na sa negotiate natin ng very indicative lang na meron talaga is this coming February yung 50,000. And we are still negotiating with the companies na there should be an early arrival. So that's why, as I have said earlier, the supply agreement is still ongoing and we are still negotiating for early delivery. So most likely, the main bulk of our orders will be at Q3 and Q4. But we are negotiating for an early delivery.
Opo. And may iba pa po ba na magdo-donate ng vaccine apart from China?
Yeah, we have already confirmed that 500,000 from Sinovac from China will be donated for us. Once that the EUA has been approved, they can deliver immediately.
How about other countries po?
Yes, meaning the other countries, we are I think negotiating with 2 countries.
Opo. Which countries?
There's a positive, but we will not
disclose it yet.
Declare yet because the negotiation is still ongoing.
How many vaccines?
We have negotiated for 2 countries.
2 countries.
And also 2 products.
Okay. Thank you, sir.
Thank you, Vivian Gula. And our next question will be coming from...
Hi, sir. Good afternoon. I'm Jenny from TV5. Sir, Secretary Galvez, kasi napapag-usapan na po yung cold storage once dumating na dito yung vaccine. Paano naman po yung pag-transport doon sa mga vaccination site? Paano po natin mapipreserve yung efficacy nun? Sino mag-handle pa rin po nun?
Yung usapan po natin ng mga vaccine manufacturer, ang sabi nga nila, it will be throughput. Yung throughput is just identify yung vaccination center and they will provide the vaccines So meaning they already have a service provider that have they contacted, and that's the way they will deliver the vaccine. Particularly Pfizer and Moderna, these are the most critical ones, and we will make sure that the deliveries of these will be taken care of immediately. And I believe Suili has the capability of really have that central management and storage, considering their capacities to use that can cater all the different vaccines.
Sir, may we know the process? What will be the process on delivering those vaccines to the vaccination sites?
We will receive the vaccines here. We will store it centrally in the required temperature ranges depending on the vaccines that is available. Based on the delivery and the vaccine itself, we will obviously make sure that it's packed according to the requirements. So if it's Pfizer and it's -80, it will be packed with dry ice, and there are temperature loggers, and then it will be dispatched to the centers. We have capacity here in Metro Manila. We have also capacity in Cebu and Davao, and we have validated packaging methods that will last for 2 to 8 up to 4 days, and for -20 and -80 for 24 hours, which is sufficient to reach the vaccination center.
Okay. Sir, how long yung pananatili ng vaccine, pag halimbawa dumating na siya dito sa Unilab, for example, as Sulig, ilang araw siya bago siya ma-deliver sa mga vaccination sites, sir?
I believe, nasabi ko na po kanina na meron tayong tinatawag na inspection from the airport, and we will still have yung tinatawag na time and motion at the airport, and we will make sure that the delivery will not be delayed. Ang ano po namin na kung mapunta po sa inspection dito na po sa warehouse, we will make sure na it will not exceed 5 days.
Sir, last on my part. Update lang, sir, doon sa Moderna. Ano po yung update na? Kasi you've mentioned yesterday or the other day na kung na-signed na ba, sir, yung term sheet expected you mentioned?
Yesterday, we negotiated with Moderna, and with us negotiating is our Ambassador Romualdez and also business Enrico Rizon. And it is some sort of multilateral agreement between the business sector, the LGU, the vaccine maker, Moderna, and the national government. We are negotiating on splitting the 20 million to 10 million for the private sector and the LGU, and the 10 million for the government. And we are very happy to report that the business sector and the LGU already break the 5 million mark.
Thank you.
Thank you, Jenny Dogon. And now, the next to ask is from CNN.
Good afternoon po. I'm Carolyn Bongkin from CNN Philippines. My first question is for Secretary Galvez. Sir, I understand that you're still inspecting various cold chain warehouses. Sir, when do we expect your final when do you expect po na magkakaroon tayo ng final decision on who are you signing a contract regarding the storage po?
We are expecting that the final contract of supply agreement will be finished within January or maybe first week of February. And we expect that upon learning the indicative date of the delivery, we will be having the final rundown and rehearsals, and we will coordinate with the LGU so that all the rehearsals and also the time and motion from the airport to the warehouse to the LGU, it will be timed and it will be rehearsed, and I believe the critical terms are already been ironed out. So we are very confident that by January all the contracts will be finished.
Sir, we already have about 20 candidate cold storage warehouses. Sir, what exactly are you looking for po? What exactly are the criteria that you're looking for po for the storage facility?
Well, fundamentally, yung kakayahan nila mag-store ng +2, +8, -20, negative 70 to negative 80 degrees centigrade, that's really very important. Para hindi na hiwa-hiwalay, doon na lang, consolidated na. And then, of course, yung kanilang distribution strength. So, from their national, say, their central hub, meron ba silang regional distribution hub, meron ba silang warehouse, meron ba silang cold storage capacity in the regions, and then from the regions down to our vaccination sites, no? And we are looking at we're preparing about 4,500 vaccination sites to include public and private hospitals, LGU hospitals as well, the city health offices, the provincial health offices, the rural health units, the other implementing units, the hospitals, health facilities of the PNP, AFP, the BJMP, the Bucor. So we're going to use all these facilities as immunization sites, no? So in the Selexo, tama ka, no? There are about more than 20 that our supply chain USEC has met with. And of these, there are only 4 so far that seem to qualify insofar as our distribution, our warehousing, our hauling, our distribution to the vaccination sites are concerned. So, yung 4 na yun, di ko alam kung yung mga iba makakahabol pa, but we are in the middle of negotiations with them.
So most likely, sir, yung the rest of the 16, yung logistical concerns, yung reason kaya mas qualified yung 4.
Yes, kasi ayaw natin ng isang third-party logistic provider na hindi niya kaya lahat gawin. Kasi ang ideal scenario, end-to-end supply chain system adequacy and readiness. Hindi pwede yung process A to C kanya, tapos D to F, E sa subcontract niya sa iba. Mahirapan po tayo. Bakuna po itong pinag-uusapan natin. Napaka-sensitive po nito. Kaya kinakailangan talaga, kailangan talaga ang gagamitin dito, pharma-grade na mga cold storage facilities katulad ng Zwellig Pharma and also Unilab and also the other cold storage facilities within the capacities of the third-party logistics provider.
Sir, kasi most of the vaccine supplies will arrive here in Luzon. How about Visayas and Mindanao po? Is it possible or are you planning to have some of the doses directly shipped to the island provinces or to Visayas and Mindanao po?
It will depend to the third party provider and also the pharmaceutical company and also vaccine maker, because there are also, for as long as there is storage in the areas of Cebu and Davao and other major cities, okay po yun. Pero parang nakita namin na the possibility of deploying directly yung mga strategic locations like Cebu, Cagayan de Oro, and also Davao, these are the major hubs na pwede siguro na diretso. And we are talking with the pharmaceutical companies and also with the vaccine company makers. Nga sinasabi nga ni Sir na end-to-end. Kailangan pagka once na in-store yun, yung sa main storage yun, yung vaccine, they have the capacity to deploy it. Meaning, ibig sabihin, may strategic reach yan to deploy anywhere.
Secretary Galvez, during the ULAP forum yesterday, you've mentioned that Moderna price is around $20 US. Sir, can you confirm this po?
Ang ano po natin, nire-range natin kasi ay CDA eh. So, pagka nagsabi ako, there is no exact prices. Yun, galing nyo sa internet. Yung prices niya is around 32 to 37. 32 to 37 ang price niya. Yan ang nasa market price na yan. You can sa internet. And yun nga, once na binabalance po natin yung efficacy at saka yung cost. Kaya po yung sinasabi nga natin na 3 klase yung ating criteria: safety, efficacy, at saka yung cost efficiency. Meaning, kung pareho naman yung kanyang efficacy, and then magkaiba yung price, you can buy one, while you can buy 2 or 3 sa other. For the purpose of equity of access, mas maganda bilhin mo na yung cost efficient. So meaning, ganun ang ginagawa namin. Sa negotiation, we have a lot of options. Yung 7 na options na tinitingnan namin yun, based dun sa criteria na binigay ng Vaccine Expert Panel. And from there, pagka binigyan ng rank ng BEP, yun ang binibigyan namin ng mas weight yung nasa taas. So we will buy more volumes doon sa taas while we will buy a lesser volume doon sa baba. Kasi tama yung sinasabi ni Sec Duque at saka ng BEP na yung mga vaccine, iba-iba kasi yung gamit nila. May pang bata, may pang general purpose, merong pang elderly. So kaya po, kumukuha tayo ng portfolio.
Sir, do you have a list na po kung sino yung nasa top, sino yung nasa bottom?
Yeah, actually meron tayong list. Yun nga ang pinakikita natin sa ating mga presentation na during the Congress hearing, pinakikita natin yun talaga. Nakikita nila na talagang yung mga ranking na ando.
And on top of the list is which vaccine, sir?
Nakita natin na naka-top sa list Pfizer and also yung Sinovac number 4 and then also Moderna at AstraZeneca. Yung top 4 na yun ang nasa taas namin.
Sir, last.
And then J&J, baka maging maganda yan kasi wala pa kasi wala pang tinatawag na SRA o Stringent Regulatory Authorization o UAE, kaya medyo nasa baba pa siya.
Sir, last 2 na lang po. Sir, when will you release po the official price list based on our negotiations?
If the company already allowed us, kasi CDA is basically an agreement, it's a contract that we will not reveal prices when we are still negotiating, including yung trade secrets and also the volumes and also yung delivery. When we sign the supply agreement and the parties agree that we will announce it, we can announce it now. But while we don't have yet the final contract, it is really some sort of honorable agreement with trust and confidence that we will not reveal any prices because they are also negotiating with other countries. And necessary divulging of that information will compromise both negotiating terms, both of us and also them. Because for every violation that we will make, we might lose the volumes. We have also the same issue in with Malaysia. So if you look at the December 27, I think the Times Street journal in Malaysia, we have the same question of when we will reveal the info, it will compromise the pharmaceutical delivery. So it will compromise the contract. They might withdraw the contract and we might lose the 148 volumes.
This question is either for Zwelig representatives or for our cabinet secretaries. Sir, there is actually an ongoing message in some Viber groups offering Moderna vaccine. Supposedly, it's through an allocation of ICTSI from Zwelig Pharma. Sir, can you confirm this? And the President recently said that it's okay for private individuals to buy vaccines as long as it is approved by the FDA. However, some doctors said that it is important to have our priority sectors vaccinated first so we can achieve the herd immunity first. Sir, can you comment on this? Will we follow the President's statement or are we going to stick with our priority sectors? Thank you.
I believe we will stick with the priority of that's why we get the Moderna, is also for our health workers. Actually, we are trying to convince them to have it on February, even smaller dosage. But I believe because of the Moderna is now becoming one of the most sought brand. They cannot pull out their supplies because it's already committed. But rest assured that the healthcare workers will be given the priority, and it will not be, it will not be compromised. Because the main objective of our vaccination is really to preserve our healthcare system, and that is a WHO regulation. And maybe Secretary Duque can explore.
Thank you, Sec Galvez. Number one, we have to anchor our immunization program implementation on the agreed upon prioritization formula. The prioritization formula is very clear. Healthcare workers, and then the senior citizens, and then adults with comorbidities, the indigent population, the uniformed personnel of AFP, PNP, and then you have the 6 up to about 12 other priority groups or sectors. No? So we need that so that there is order in the execution or implementation of the vaccine rollout plan. You know? So even if say a private company with, of course, the president saying that, okay, if you want to import, you can import. But we are also appealing to the private companies to channel their importation through our model of tripartite agreement. So that way, mas maayos po ang ating implementation. Kasi kung wala tayong mga ganito, kanya-kanya na, no, masisira yung prioritization natin. Then, that might affect the credibility of government because it's allowing kung sino na lang, no? Free for all. And so this is not good. So still we stick to our prioritization formula. So yung mga private sector, kung may mga doktor sila sa companies nila, may nurse sila, yun ang unahin. Kung nataubos na nila yun, susunod naman. Kung may mga halimbawa, mga 60 and above sila na mga workers, di yun naman ang kanilang iniksyonan. Kung may mga empleyado sila with comorbidities, may hypertension, di yun naman ang susunod. So, ganun lang. Yun na lang yun. You go through several cycles observing the prioritization formula.
Actually, pumasok yung business sector because we have only limited funds for the portfolio. Normally, the amount that we can only give to Moderna is only 10 million. Considering that the Moderna offered 20 million, the business sector wanted to get the additional 10 so that we can have the volume. So ibig sabihin, ang gusto ng business sector is not to get it for them. It is for us to get the volume, additional volume, because they feel even though Moderna has a relatively higher prices, the cost of the vaccine is lesser as compared to the loss in business. So what they wanted is to get the volume, the national volume, and have it increased by 10 million. By having that, their perception is that it is an additional 5 million people, 5 million Filipinos that will be vaccinated with the volume that they can get.
10 million doses po.
Yes, actually, yun ang namin. When we negotiated, sinabi nga namin sa kanila, with the prices of Moderna, considering it is the highest price among the vaccines that we had, limited lang ang makuha natin. But the business sector and also some of the NGOs volunteered to help us. And that's why we are very thankful with the business sector that it increased our volume by more or less 10 to 12 million doses. That's 6 million Filipino that will be vaccinated.
Thank you, sir.
Thank you, Caroline Bonkin of CNN. Now, let's move on to Ian Cruz of
Good afternoon po, Secretary. My first question po, of the more than 20 cold storage facilities, can we say na very strong contender ang Suwelin Pharma?
Based on our assessment today, yes, we can say that. Apart from the fact that our supply chain management office and their technical team are also doing their own evaluation. So, meron silang matrix. Nakalagay doon ano yung mga kakayahan nila vis-a-vis the end-to-end supply chain system. Preparedness, readiness, and adequacy. So, yun po yung may criteria tayo in objective criteria in the selection.
Okay. Secretary Galvez, we understand may meeting daw po kayo with Senate President Tito Soto. Ano po yung pag-uusapan niyo? I-reveal niyo po ba sa mga senador yung prices ng mga bakuna natin?
Nung nagkaroon po ng last meeting namin sa hearing, I requested for some sort of an executive session, and we agreed na magkaroon ng meeting with Sentro Balita and the other senator. As I have said earlier during my interview, we want to reach out with the Senate and the Congress, because these are the important body. They help us a lot in our legislation for Bayani 1 and Bayani 2. And we thought that it's better to work together and see on how we can reconcile on the issues. And I received a call this morning and also last night through Senator Bongo, and he said that you are directed by the President to report to SP and explain how the negotiations are ongoing and how it is being done for the sake of transparency. So we will discuss, and without violating the CDA, we will discuss things so that they will understand on how we negotiate, and we will explain that really there is a due diligence, there is some sort of integrity on the way we are negotiating things. So that's the explanation that we will be having, and maybe we will tell them on how much comparatively that we have saved due to the diligent and very long negotiation that we had with the companies.
Sige.
Thank you. Also, the Congress, Senate and the House are really crucial partners of the executive branch of government. Because again, the pieces of legislation are needed. No? For example, we are appealing to both houses to legislate an indemnification fund, say for individuals who get vaccinated and manifest serious side effects. No? That's one. Number two, we're looking at legislating the issuance of an emergency use authorization, despite the fact that there has been an executive order, number 121, authorizing FDA to issue EUAs to the candidate vaccines once they have been evaluated as possessing high benefit versus risk. No? There's going to be a risk-benefit assessment in that regard. So, and the tax exemption that we would like to appeal to Congress to also legislate. No? So there are many evolving pieces of legislation that can help ensure the successful response of the national government against the COVID-19 pandemic. No? So pagdating dito sa bakunahan, marami pa tayong kailangan po ng mga batas na maipapasa.
Okay. Last na po, Secretary Galvez, ang publiko po kasi, kino-compare nila yung price na lumalabas na ito yung price na gagamitin natin or kukunin natin for Sinovac, and yet doon sa Thailand and Malaysia, ganito. Yun po kasi yung nagiging dahilan nila kung bakit sila nagdududa dun sa presyo natin at bakit daw hindi nyo ma-reveal.
Dapat po natin malaman yung pricing, hindi po talaga pareho yan kasi may mga conditions. Yung sa Thailand, questionable yun kasi maybe mayroong conditions yun na yung filling station sa Thailand. Kasi ako po, inoperan din po kami ng Sinovac na maging filling station tayo dito. Pero nung in-evaluate namin, talaga wala tayong kapabilidad. Pwedeng mangyari yon na $5 yon kung yung Thailand ang magiging filling station. As we know, Thailand will be the source of AstraZeneca. So may capacity sila to have a filling station. Isa yun sa condition. Secondly, mas mababa ang presyo ng iba dahil kasi kukunin na mismo doon sa manufacturer. Meaning, doon nila kukunin doon sa point of origin. Talagang bababa yun. Pangatlo is, kung malaking volume ang kinuha, talagang bababa yung presyo. Yung kukunti ang volume, mas mataas ang presyo nun. Pero kung titingnan natin yung presyo ng India at saka Indonesia, hindi po tayo nakakalayo po. Ang nakikita po natin talaga, very fair at cost yung ating mga presyo. Ang masasabi ko lang po, yung lahat ng mga companies na aming nine-negotiate, ang kanilang negotiating price is at cost. Karamihan po sa kanila no profit or very marginal profit because the WHO give them the guidance that during this pandemic, kailangan no profit, equitable access at cost at saka para at least magkaroon ng tinatawag na no privilege access. So majority of the company hit on the request and the directive of WHO. So nung kinumpute namin yung from the price printed in internet, kinumpute namin yung price namin mas mababa ng 1.2 billion. Yung na negotiated price. It means na talagang napakababa namin nakuha. Nasa best price siya. So yung sinasabi na 3,680, hindi po tama yon. Kaya nga sinasabi namin, yung presyo ng Sinovac, hindi tataas ng 700 pesos. Kung titingnan nyo, baka mas mababa pa yung presyo natin sa India.
Thank you, sir.
Can I just say underscore? Gusto ko lang bigyan din, itong kasing CDA, no? Alam ko nagiging sanhi ito ng kalituhan, kaguluhan sa isip ng ating mga kababayan. Ibig ko lang pong bigyan din na itong mga confidentiality or non-disclosure agreements, these are conditions set not by government, but by the vaccine manufacturing companies. Ngayon, kung hindi tayo papayag doon sa conditions na yon, simple lang ang endpoint. Ano endpoint? We don't get the vaccines. Kasi kakaunti po ang bakuna. Hindi po ito kaya pang masuplayan ang global demand. Kung yung isa pipirma ng CDA with them, doon sila pupunta. Bakit sila magsasayang ng panahon sa atin kung ayaw naman natin pumirma doon sa CDA na sila mismo ang nag-set ng mga provisions? But having said that, pinag-aaralan po talaga yung due diligence na sinabi po ni Secretary Galvez, ilang gabi na yan, hindi kami nakakatulog dyan na tinitignan talaga yung mga provisions na hindi po ito dapat disadvantageous or onerous to the Philippine government. But there are certain provisions na non-negotiable Wala tayong magawa. No? Otherwise, are we going to waive our access to those vaccines? Hindi naman pwede. Because insofar as, values considerations, yung safety, yung protection ng ating mga kababayan ang number one against this virus. Kaya pumirma tayo doon sa CDA. Otherwise, tama yung sinabi ni Secretary Galvez, kung hindi tayo pipirma, hindi tayo susunod, we will violate the CDA, then we lose 148 million doses.
Thank you, Ian. Do we have... Okay, last... Wrap up na. Do we have questions? Yes. May UNTV po ba? Ayun na. Okay na daw.
Sir, habol lang po, Secretary Galvez, sabi daw po ni Secretary Roque, sinabihan po kayo ng Pangulo na mag-walk out if senators verbally abuse you po sa Senate hearing. Were you asked by the President or were you told by the President, advised to walk out po kapag daw po verbally abused kayo sa Senate hearing po?
Unless directive niya sa akin is to reach out. To reach out with the Senate President, also with the Senate members. So siguro yun lang ang tingnan natin.
Okay. Walang ganung payo, sir.
Mas maganda itingnan natin yung last na directive sa akin. the directive to me is to report to Senate President Vic Soto. So I will report to him.
Vicente Soto, sir.
Vicente
Opo.
Soto.
And totoo po ba na ayaw nyo nang umattend ng Senate hearing dahil mawawalan po kayo ng time to meet with vaccine makers?
If I'm directed to attend, I will attend. Ang ano lang naman sa natin is ang nakikita lang natin is talagang sa ngayon kasi very critical yung date eh. Every day na talagang mawala ako sa negotiation, napakahirap kasi once na we were not able to close the contract, nag-slip sa ibang quarter yung deliveries eh. Kasi nag-uunahan yung mga ibang countries. So hanggang hindi natin yung supply agreement, nag-slip out yung chances baka mamaya mawala yung ating mga doses. So what I want is to really finish first itong negotiation. Hindi naman ako tatakbo sa responsibility eh. And I can assure you that what we are doing is clean and we are very talagang walang corruption sa ginagawa namin. Pangalawa, ang natin is talagang yung pera, it will be a bank-to-bank agreement. So diretso sa company babayaran ng Asian Development Bank at saka World Bank. Alam na mga yan, pati mga pharmaceutical companies, very stringent ang regulatory niyan. Walang corruption talaga yan.
Opo. Pero dadalo pa rin po kayo sa mga susunod na pagdinig ng Senado, for example, sa Friday po?
Yes, dadalo ako.
Okay. Sir, just a follow-up. Sir, just a follow-up question lang po. Kailan po yung meeting niyo with Senator? Iba pa to sa pagdalo niyo po sa Senate hearing?
Hindi ko muna may disclose para bukas na lang pagka mag-announce na po kami.
Opo. And one phone-in question lang po kay Secretary Duque from Naomi Tiburcio of PTV4. LabX Corporation is advocating a do-it-yourself home antigen test with online monitoring ng nurse or doctor. Nakarating na po ba ito sa DOH at ano pong komento niyo dito?
Sa ngayon po, wala po akong komento patungkol dyan. Padadaanin po natin sa ating COVID-19 Laboratory Expert Panel. At sila po ang susuri, they will evaluate itong ganitong self-administering antigen testing for COVID-19 determination. So, yun lang po masasabi ko.
Okay, thank you so much po sa ating panel for today. To wrap up the press conference, can we request our officials to stand up for a short photo op? And thank you so much also to our media friends.
Sige po, ready? In 3, 2, 1. Okay, once again, marami pong salamat po sa ating mga panelists at ganoon din po sa ating mga media partners for joining us in this press con this afternoon. Thank you so much and goodbye po. See you next time.
Pwede ba palakpakan naman natin ang Zwelling Pharma sa kanilang mainit na pagtanggap sa ating lahat? Okay, maraming salamat po.